We're one of the patient organisations that's involved in the overall project, bringing a patient perspective on lymphoma in particular, obviously. It's important to involve the patient perspective because big data represents everything we know about a particular disease area, lymphoma in this case, and it's important that it's not just clinical data, but the patient perspective is involved as well, because while it's important about how effective clinical treatments are, lymphoma is a collection of many different diseases where for many quality of life is as important as quantity of life, so we need to know the effects of the lived experience of lymphoma, how a treatment affects someone's health, the side effects, longer term effects, their survival and so on. And that's not always immediately captured in clinical data. So patient perspective, patient data is really important to these projects. Well, at the moment, we're trying to engage with the key opinion leaders, the team leaders that are involved in the work packages around non-Hodgkin's lymphoma. And the first thing we're trying to define is which is the right subtype to concentrate our efforts on, because lymphoma, as I mentioned earlier, is a collection of upwards of about 80 different subtypes. So it's important we find the one where the big data that we use and analyse can be used to maximum effect to answer the best questions where there's the biggest need in lymphoma.